When it comes to managing osteoarthritis joint pain, NSAIDs are one of the most effective tools that we have. They reduce inflammation, relieve pain, and improve mobility. But at the same time, we hear a lot about their risks, including cardiovascular concerns, digestive issues, and long-term effects on the body. So how do we make sense of all of this? Are NSAIDs worth taking, or are the risks just too high? The answer is not as simple as just yes or no, because when it comes to osteoarthritis, the risk of immobility and inactivity due to pain is also a major health concern. Hi, I'm Valerie, a lifestyle nurse and an osteoarthritis wellness specialist. I believe that no matter your age or current health status, even if you've been diagnosed with arthritis, you have the power to take charge of your well-being and live a longer, healthier, more active life. My goal is to share with you the knowledge and the tools that will empower you to make that happen. In this video, I'm going to break down the role of NSAIDs in osteoarthritis treatment. I'll talk about their effectiveness, the risks that they pose, and why the conversation around them shouldn't just be about their side effects, but also about what happens when pain isn't managed properly. By the end of this video, you'll have a clearer understanding of how NSAIDs impact the body, the risks to consider, and how to make the best decision for your health. There is no denying that NSAIDs are the gold standard for osteoarthritis pain relief. Studies have consistently shown that they provide significant reductions in pain and improvements in function, especially when taken at appropriate doses. Among the most effective are diclofenac and etoposide, both of which have been found to outperform other oral pain relievers, including other NSAIDs, in managing osteoarthritis symptoms. Coming in at a close second are meloxicam and celecoxib. Over-the-counter NSAIDs have been shown to be the least effective of NSAIDs, but still more effective than acetaminophen, which has been shown to have very little effectiveness at controlling osteoarthritis pain. Your results, though, may vary. For many people, NSAIDs can be the difference between staying active and being sidelined by pain. And that's important because osteoarthritis is more than just wear and tear on the joints. Chronic pain leads to reduced mobility, which can spiral into muscle weakness, weight gain, and increased risk for other serious conditions, including cardiovascular disease. But the problem is that NSAIDs don't just work on pain. They also affect other systems in the body, including the heart and the digestive tract. One of the biggest concerns surrounding NSAIDs is their impact on heart health. Research has shown that taking NSAIDs, even for a short period, can increase the risk of cardiovascular issues. This includes things like higher blood pressure, an increased likelihood of blood clots, fluid retention, and even worsening heart failure in those already at risk. For those with a history of heart disease or high blood pressure, this is something to take seriously. The way that NSAIDs affect the heart is complex, but one of the key issues is their influence on blood flow regulation and clotting. These medications can disrupt the balance between substances in the body that promote and prevent clot formation, leading to a slightly higher risk of heart attacks and strokes, especially with long-term use. At the same time, NSAIDs can also affect kidney function, which can in turn raise blood pressure. Since kidneys play an important role in regulating fluid and electrolyte balance, any disruption in their function can lead to fluid retention, swelling, and added strain on the heart. For people already dealing with high blood pressure or heart failure, this additional burden on the cardiovascular system can be a serious concern. But here's where the conversation gets tricky. While NSAIDs can contribute to cardiovascular risks, so can chronic pain and immobility. When pain limits movement, it often leads to a more sedentary lifestyle, which is one of the biggest risk factors for heart disease. People who are in constant pain may struggle to stay active, which can lead to weight gain, worsened circulation, and increased inflammation, all of which are also harmful to heart health. And all these can also worsen osteoarthritis. So the decision to use NSAIDs isn't just about whether they carry risks. It's also about weighing those risks against the consequences of untreated pain. It is also important to understand that these side effects are just a possibility and not an absolute certainty that they will occur. However, for some, avoiding NSAIDs still completely makes sense, especially if there are significant heart concerns. For others, the ability to stay active and maintain a higher quality of life outweighs the potential cardiovascular risks. This is why working closely with a healthcare provider to assess personal risk factors is so important. NSAIDs are not one size fits all, and for those who do need them, finding the right dose, using them for the shortest time necessary, and monitoring heart and kidney health closely can help minimize potential harm while still allowing for effective pain relief. NSAIDs are also well known for their digestive side effects, particularly their impact on the stomach lining. Over time, they can cause irritation, increasing the risk of ulcers, bleeding, and digestive discomfort. For people with a history of ulcers or acid reflux, NSAIDs might not be the best option unless steps are taken to protect the stomach. One way to reduce gastrointestinal risks is by using the lowest effective dose possible. Another important option is to pair NSAIDs with a proton pump inhibitor, like omeprazole, which helps protect the stomach lining from damage. There's also a common misconception that NSAIDs cause or worsen gastroesophageal reflux disease, or GERD. While NSAIDs can irritate the stomach, they don't necessarily cause reflux, but they may weaken the lower esophageal symptoms, making symptoms for those who already have GERD worse. Again, this is just a possibility and not a given, but it certainly warrants close attention. The conversation around NSAIDs often focuses only on their side effects, but it's just as important to consider what happens when pain is left untreated. Chronic pain affects every aspect of health. It reduces mobility, it increases stress, and can even lead to depression and anxiety. And the less active someone is due to pain, the more they risk developing muscle loss, developing cardiovascular issues, and metabolic problems. So when weighing whether or not to take NSAIDs, it's not just about asking, are they safe, but also what are the risks of not taking them. It is important to weigh both the pros and cons. For many people, NSAIDs enable movement, exercise, and an overall better quality of life. The key is using them wisely, monitoring for side effects, and having an open conversation with your doctor about your own personal risk factors. Now, the pain associated with osteoarthritis can be managed in other ways than just medication. There are several lifestyle changes that can reduce inflammation, protect the joints, and even slow the progression of osteoarthritis. One of the most effective approaches is regular movement. Gentle, consistent activity like walking, cycling, or swimming helps to keep the joints flexible and strengthens the muscles around them for better support. It might seem counterintuitive to move more when you're in pain, but staying active can actually reduce pain over time by improving joint lubrication and stability. Diet also plays a huge role. Eating more whole, anti-inflammatory foods like vegetables, fruits, nuts, and omega-3 rich fish can help reduce inflammation in the joints. On the other hand, a diet high in processed foods, sugar, and unhealthy fats can contribute to more inflammation and pain. Weight management is another factor to consider. Even small amounts of weight loss can significantly reduce stress on the joints, particularly in the weight-bearing areas like the knees and hips. Losing weight can also reduce inflammation in the body, which will also lead to less joint pain, more mobility, and slowing the progression of osteoarthritis. Look in the video description to learn more about a program that teaches science-backed lifestyle management strategies for improving osteoarthritis symptoms without medication. Lifestyle changes completely turned my own osteoarthritis around and allowed me to get back to being highly active. I would love to help you do the same. There is no one-size-fits-all answer when it comes to NSAIDs. They are incredibly effective for pain relief and improving mobility, but they also carry risks, especially for people with heart conditions or digestive issues. The best approach to osteoarthritis management is a balanced one. If you need NSAIDs, use the lowest effective dose, monitor for side effects, and also focus on other strategies like exercise, weight management, and joint-friendly nutrition to support your long-term joint health. If you found this video helpful, let me know in the comments. Have you used NSAIDs for osteoarthritis? How have they worked for you? Everyone's journey with osteoarthritis is different, so I would love to learn more about yours. And if you would like to learn more about managing joint health naturally, be sure to like, subscribe, and hit the notification bell so you don't miss future videos. Thank you so much for watching, and as always, please take good care of yourself.